More and more doctors are raising the alarm about conditions at Kelowna General Hospital. In a statement on Friday, 9 OBGYNs said the maternity ward was nearing collapse. That follows the closure last week of the pediatric ward. And then over the weekend, Doctors of BC released a statement on behalf of 130 doctors, all in support of their colleagues. They called the pediatric closure, quote, a significant departure from standard care expectations, and they laid the responsibility squarely at the feet of Interior Health. Now, the CEO of Interior Health, Susan Brown, declined our interview request, as did the Minister of Health, who referred us back to Interior Health. Gavin Dew is the BC Conservative MLA for Kelowna Mission and is in our studio this morning. Gavin Dew, good morning.
Good morning. Thanks for having me.
Thank you for joining us. What do you make of all this?
Well, it sounds like your experience is similar to my experience. I've been an MLA since October, and I'm still waiting for a briefing from Interior Health.
Come on.
Yep.
How many times? Tell me more. Explain.
We've made a number of requests to get up to speed, but it feels as if there is just this wall that's been built around the system here. We're experiencing it as MLAs. We experience it in the legislature when we get non-answers and evasions and cherry-pick numbers over and over and over again from the minister. But it's also clear that the very people who are working in Interior Health, the frontline medical professionals, also feel like there's a wall between them and the running of the system. We have all of these letters, all these communications that have come out. We're learning about the collapse of the system from frontline medical professionals instead of from the people that ought to be communicating with us as the public or as elected officials about it. And most dangerously, most scarily, the number of conversations I've had recently with frontline medical professionals who are sending me anonymous emails or who are grabbing me at events and talking to me and saying, you can never say my name, but.
Yeah.
They're afraid of consequences. They're afraid of what happens if they speak out. And yet, nonetheless, what I think we're seeing is the dam breaking, where not only is the system at the point of collapse in a way that's unsafe for patients and for families, but we also have the dam breaking in terms of those doctors and those other professionals just refusing to accept the ongoing secrecy and the ongoing evasions and starting to share information with the public out of, I think, just desperation to be heard.
Now, I should be fair and say that we have heard from sort of mid-level of Interior Health, Azan Azam, who runs the Southern Interior section of Interior Health, was on our program on Radio West on Friday, but we've yet to hear from the CEO. You say you haven't been briefed by Interior Health. What do you want to hear from them? What would you ask them if you had the opportunity? And we'll get to the political stuff in a sec, but I'm just curious about what you want to hear from the kind of the bureaucracy from Interior Health itself.
I think what we do need to know is what's actually happening in terms of system conditions. What are the actual numbers? One of the great sources of frustration that we have when we get into the legislature, when we try to speak with folks, is that we get cherry-picked numbers. So there was probably an hour spent in budget estimates debating the number of doctors who had been brought into the system. And we would get a gross number, 1,000. It took an hour to extract a net number, which was less than half of that, and yet more time to actually get the Ministry of Health to talk about that in per capita terms. So for me, as someone who comes from business, what gets measured gets managed. And if what you're getting is cherry-picked numbers that try to paint a rosy picture, and you're actually avoiding talking about net new hires, you're avoiding talking about per capita numbers, you're avoiding talking about funding in real dollar terms, then you're not actually measuring what's happening in the system. So what we want is, an honest, forward-looking, constructive assessment of what's happening. And I think most importantly, on behalf of all those doctors and nurses and frontline workers, I want them to be heard in the system, which is clearly not happening now.
It's interesting you mentioned that. I just pulled up the response, the decline we got from the Minister of Health when they declined our interview request, and they too gave us the gross number. Over 570 doctors from the U.S. said they are interested in moving to BC, but that tells us almost nothing about the situation at Kelowna General Hospital.
I think it's a big political statement. Obviously, I'll be happy with any situation that brings more medical professionals into the system. But what it appears the government is doing is focusing on political posturing around, people being political refugees from Trumpian America and coming here. They're not looking at actual numbers. If you're a nurse in the States, you're getting paid a heck of a lot more than here with a lower cost of living, and you're going to be taking a pretty sober assessment of what your actual financial trade-off looks like.
You have talked to some doctors doctors, I understand you're talking to more today. You mentioned system conditions. It's very difficult, at least from our perspective, to understand what's actually going wrong at KGH. We get Interior Health telling us it's a doctor, like a global doctor shortage. We get doctors telling us it's a toxic work environment. None of them will go on the record, but as you say. And so there's obviously some kind of systemic breakdown here. Do you have any understanding? Are you closer to any understanding today than you were 2 weeks ago about what the problem is?
Yeah, I think I'm getting closer. I have, 5 doctors on my schedule today, and I've got another dozen in the next week that I'm talking to in order to try to better understand directly what's happening here. I think that it's never only one thing. Sure. Certainly trying to get more trained professionals, doctors into the system is one aspect, but I've also been hearing loud and clear that, for example, on the pediatric front, there are 20 pediatricians in Kelowna that refuse to work in the KGH system because of working conditions. So that, to me, speaks to a problem that is not just a matter of getting more docs into the system.
When the provincial government is upset with the school board for whatever reason, they sometimes come in and take over the school board and appoint their own administrators and try to right the ship. Is that something that you think is required in this case?
Well, it's certainly clear that they're probably not happy with performance. This is the second CEO of a health authority that we've seen depart in a relatively short period of time, along with Victoria Lee, who was the CEO of Fraser Health. So it's clear that there is an effort afoot to get a grip on what's happening. The province is bringing in Penny Ballum as a consultant out of the Premier's office to help turn around the healthcare system, but she's also the person that got the healthcare system to where it is today. So it feels as if they're sort of rearranging deck chairs on the Titanic rather than fundamentally changing course.
The Kelowna General Hospital and Interior Health both insist, and the ministry too, that Kelowna General Hospital is safe, that there's relatively little patient impact, that critical people will be transferred to hospitals that can handle them. You mentioned a moment ago you worry about unsafe conditions at the hospital. Why do you worry about that? What evidence do you have that there might be actual effect to patients?
I worry about it because that's what I'm hearing from doctors and nurses and other frontline workers, and we're all reading it in the news. I think obviously we want to be able to assure people that their children are safe, that they are safe, and that they can rely on the system. That's how things should be. But when we have doctors flagging the terrible moral choices they feel uncomfortable being forced to make because of understaffing, when you hear stories around having to choose between a mother in distress giving birth, between the life of a mother, a child, and another child down the hall who's waiting for a doctor, that doesn't sound like safety to me. That sounds like a system that is in real trouble.
In opposition, what can you, practically speaking, do?
We can ask questions and we can amplify voices. So we've been asking questions this entire spring session in the legislature. I think we're all getting pretty tired of getting the exact same response every time that we're working on it, and that here's a cherry-picked number that doesn't actually reflect the conditions on the ground but tries to paint a rosy picture. And we can amplify voices, and that's exactly what I'm doing here today. I've been reached out to by countless doctors, nurses, professionals who are afraid to speak out, who want someone to amplify what they're saying, and I'm doing that. And today, and in the days to follow, I'm doing what the government isn't doing, and I'm listening directly to frontline medical workers who are flagging not only the problems of the system, but are trying to offer constructive solutions to make it better.
Let's talk about constructive solutions, because as opposition, obviously, you hold the government accountable. Part of your role is also to say, well, here's what we would do. So what would a BC Conservative government do to, in short term, medium term, to fix these acute problems? We can long term, sort of a different question at the moment, but right away, what do you think could be done here?
I think the way you're constructing the question actually speaks to a big important part of it, right? So in the longer term, we've put out a fairly ambitious healthcare platform during the election. We talked about adopting best practices from European-style healthcare. There's a bigger, broader conversation around how we try to create a stronger system that's financially sustainable and that meets the expectations that British Columbians have of their healthcare system. In the shorter term, it comes down to what I've talked about. You actually have to listen to frontline workers. I've spoken to a number of doctors who've been invited to provide feedback and seen it go nowhere, who are smart people, experienced, working at the front line of the system, flagging improvements and simply feeling unheard. I'm not going to sit here and pretend that I'm a healthcare consultant or I'm a doctor or I'm a nurse. But what I do know is that you don't turn around a system without listening to the people who actually are experienced with the way that system is or is not working on the ground. So to me, the starting point is we actually have to rebuild trust and reopen communication and make sure that when there are smart people who are highly trained, who have been working in this system and in this hospital for years or decades, we're actually listening to them as we try to change the system.
How optimistic are you that this can be fixed in the short term? I mean, you've got this pediatric ward closed for another 4 or 5 weeks. The maternity ward, I haven't heard what happened over the weekend, but it sounds like it's right on the brink. How much confidence do you have in Interior Health to right this in the short term?
I wouldn't be in politics if I wasn't relentlessly optimistic that we can make things better, but it's hard to hang on to that hope right now. You know, when you see two things. Number one, when you're seeing this rolling series of crises, not only in KGH, but also in the system across BC, it's hard to have confidence. Equally importantly, my confidence in Interior Health and my confidence in the government is shaken by the fact that an escalating, growing number of frontline professionals are sounding the alarm and signaling that these folks just aren't listening. So I will start having a heck of a lot more confidence when I start seeing indications that Interior Health and the government are actually listening to and respecting and taking the advice of these good and well-intentioned frontline professionals.
Mr. Dew, good to talk to you this morning. Thank you very much.
Thank you.
Gavin Dew is a Conservative MLA for Kelowna Mission in our Kelowna studio this morning. Once again, the Minister of Health, Josie Osborne, declined our request for it. More and more doctors are raising the alarm about conditions at Kelowna General Hospital. In a statement on Friday, 9 OBGYNs said the maternity ward was nearing collapse. That follows the closure last week of the